can see a posterior arm going back there. And one thing about the cord is that definitely you really appreciate that there is a space between the bone and the dura. The space out there, what do you call that space? Epidural space, right? Whereas in the cerebrum, it's adherent. You remember those fibrillations that I've shown you from the dura hitting into the bone? You don't have that here. All of the dura is on the inside here. And there is that space between the dura, subarachnoid space, subdural space. Outside is the epidural space. And you see a nice cross section there. So you will have each representing your gray matter. On the lateral part, you have the lateral columns, you have the anterior columns, and the posterior columns. And you can, I don't know whether you can see a separation. In the middle of the posterior column, you can see a posterior separation. Right. What we have at the back there, sulcus or fissure? Sulcus. Remember, the face is anterior. So at the front we have the face, the fissure, and at the back we have the sulcus. One way to remember where the fissure is and where the sulcus is. Alright? So it means that when you go down on your fissure, you will find something just behind the fissure. Just behind the fissure, you get into the substance of the cord. So what will I be touching there? What will I be troubling there? If I were to cut inside there, I'm cutting through the cord, but I'm cutting through the root or the base of the fissure and getting into cord substance. What fibers will I cut there? The what? The spinothalamic. No, spinothalamic will be kind of lateral to that. No matter, right in the center, just in front of the cord, just in front of the canal, just in front. There is an anterior commissure there. Anterior commissure, yes. Yes. It has to be white because it's fibers. Alright? Okay. Alright. That is for those going for the top notch man. Alright? We want to fibers that are crossing from cortical, because cortical be running on lateral. Yeah, but those would be very anterior and lateral. The cortical spinal. Right here right here, remember that our central part is just behind the fissure. We're just in the middle, really in the midline. Whereas the cortical spinals are going to be lateral to that. And your vestibular spinals and so on. We're right in the center of it, just a little space. And so just some anterior commissure fibers crossing. Yeah. Alright. Okay. Let's go up a little higher to the Alright. Okay. Well, table 1, what do we have right here? Right here. Is the vicinity of the what? Huh?
Why do you want the sulfurs are the cortex?
Why is that sulcus or cortex? Well,
Yeah. So I don't know if he's touching the gray area.
The line, the circles.
alright, I wanted you to tell me the insula. Area of the insula. Alright, now I don't know whether you can see this mark here. You can see? Yeah, man. Yes, right. Um, you can see all here too. Right. You can see a dark area here. Right. Why this dark area? Huh? Stevens group, tell them man. Thalamus. What do you say table 1? Table 1? What you say? You say head of the caudate. What you say table 2? Same thing. And table 3, head of the caudate. Right. And yes, and so you would be right in saying the caudate, eh? Yes, you'll be right in saying the caudate because remember that this thing here is the lateral ventricle. You see the septum in the middle? Right, so this is lateral ventricle and this is lateral ventricle. Right, what we call the septum right here? Septum pellucidum cavum. You see the little cave? I move my thing. You can see the little cave? So it is a little cave in the septum pellucidum. Yes, it's a little cave in the septum pellucidum. Septum pellucidum cavum. Yes, right. So over here is lateral ventricle, over is lateral ventricle, and once you have lateral ventricle, the nucleus in the lateral wall and anterolateral is going to be the caudate. Right, caudate. Now, down behind here now, look. What I mean is that this is a special cut. But you can see a vessel right here. That nice vessel there, what do you think it is? Thalamostriate vein. You know this is the name? Thalamostriate vein. That means thalamus is here and striate, okay? So it's in the junction between the thalamus and the striate. Nucleus, right? So that's the thalamostriate vein. And there's another little structure that is running with them. What is that little structure? The stria terminalis. We don't really see it classically on this cut here. You see a little white thing there? One means that it would have been cut in the same plane. But I would like to see something really looking. It's not that it is not there, but the cut doesn't show it. Yeah, man, same thing on the other side. Where you see the vein, that's the thalamostriate vein. It could be the white. I would like to see something white and unmistakable. Alright, so we want to put a pin in here and tell you to identify it. I mean, the vein is obvious. So you shouldn't make a mistake with the vein. Right. Alright. So what is this thing here then? Internal capsule. But you can't just say internal capsule. Posterior limb of the internal capsule. And then there is going to be the genuine. Good. Alright. And all of this is lateral ventricle. Posterior horn, anterior horn of the lateral ventricle. Alright. I want to show you the septum from this side. You can see that? What happened is that this section, you see, is a superior cut. Is a cut at the top. So it is showing the whole. It is this is running from the roof at the door coming down. You get me? The septum is running from the roof. But if we had another cut lower, we will find that the septum pellucidum is missing. And there'd be a space where you get into the third ventricle. But we are superior. That's the reason why we see in the whole partition. Yeah. Now that I'm turning it, I have. Sorry. The corona radiate, not on this. The corona radiator you better see in one of those sections where we have removed the thalamus, and you can see the fibers coming down. I have one just like that, where you can see the fibers coming down into the brainstem. We don't tend to ask any particular thing. Some things get asked because they are common things. But you didn't see the corona radiator? Okay. I have a section with it that shows it very nicely. Alright. Let's look at some other things. Alright. This one here will show you the thalamus striate vein and the striate terminalis. Better. You just switch in the camera. On this view now, you can have a kind of a three-dimensional view of. So we have both a sagittal and a horizontal. Yeah. Okay. Now you have no doubt what this is. How is it? Choroid plexus. Good. Now look right here. Look, I am removing this thing here. What will this be? What I have removed here? This thing in the middle here. Piece of what? What is this thing here? Piece of the, remember I'm cutting in the midline. Piece of the septum, pellucidum. Okay? This is a little piece of the septum. Alright, now look. Inside. This, I'm up in the anterior part of the lateral ventricle. You can see that? I've cut across horizontal, a horizontal cut, and I have a sagittal. So I've cut in the middle, midline, and I've cut it across. So now I'm down at the bottom. In the first cut, I was I was looking at the upper part, the roof. Now I'm looking in the floor of the lateral ventricle. So in the floor of the lateral ventricle, over on the side, I see this nucleus. I see this gray stuff here. Why is this? Caudate. Good. Now look, what is this white stuff right here in the midline? This. Why is this? I give you trouble, man. This thing here, man, giving you trouble. This big thing here giving you trouble. This giving you trouble. Thalamus. Yeah, this big thing here in the center. I cut it, it's cut, I cut it across. I cut it in the midline, cut it, come down, sagittal cut. Right, that is thalamus. That is thalamus right there. So look, thalamus is here, and right in the middle, I would have had third ventricle. But my cut was not a perfect cut. So I have cut off a little piece of thalamus. Okay? Alright, maybe when I see another half, we'll see the other piece. But, so here I have what? What I have here? What I have here? Caudate, good. And this is, now you see a white thing in the middle here? Look, you can see the dark stuff. You can see the white thing right here. That is the stria terminalis. Yeah, man, that is stria terminalis there. That white thing there, that is stria terminalis. So you weren't seeing it so good on the first cut, but we see it unmistakably here. That's why I was saying that I wasn't, so much impressed by that one there because it wasn't clear. But here you can see it clearly coming around here. That's our stria terminalis. And as I told you before, terminalis means we are at the end. So we are at the end of the caudate and we are at the end of the thalamus. So right in the junction between the two is the thalamus striate vein and the stria terminalis. Okay? Alright. Well. Alright. Now, what is this thing right here? This. That? Mammillary body. Good. You're sharp on that one. And what is behind here? The corpora quadrigemina. And what is this thing with his bottom sitting down here? Pulvina. Yeah, he has his bottom resting over these two fellows' heads. Pulvina. And underneath him is the superior and inferior colliculus. Right. Okay. Wrong this side here now. Oh, pineal, let me see. Yes, like a little piece right here. You see that? Little piece of pineal. Yeah, man. Just above the superior colliculus. Right. Right there. Little piece of pineal there. Good. What he produces? Melatonin. Good. All right. So what is this fellow here? Thalamus. Good. You notice he has the other half. I have is right inside here. Little piece of thalamus on that last specimen that was cut, not exactly in the center, so I cut off a little piece of the thalamus. This is what is seen right here. Okay? What was missing on that is this piece right here. This is the other half. And underneath here is going to be what? Cavity of the third ventricle. Right. Pretty. I like the cerebellum here, man. Yeah, pretty. What is this? Mammillary body. Right, and beautiful cerebellum. Alright. Okay. Now, look at this. Alright? And I want you to tell me what these are. In the middle right there. What are those? This. Huh? What? I'm going to put the thing on it. That. What is resting on top of this thing here? Pontocerebellar fibers. Alright? Pontocerebellar. You can't miss them. You have no doubt where they're going. Okay. Alright. What is this? What is this? Huh? So is that wrong? Lingular. What other? If you look at it, it's more than lingular. Because this thing is going up to this thing here. What thing is this? This is your caliculi. This is midbrain. Look. You see? So why is it? Superior cerebellar peduncle. Good. What about this one here now? In the middle. This big thing here. See the fibers? Why is this? Middle cerebellar peduncle. Yeah man, look. It's on the pons. You see the big belly pons there? Look him. Right, guys pons. Huh? Other end would be the string on top there. Some blue fibers. Alright? They are not locus ceruleus. Alright, so these are middle cerebellar peduncle. Right. Okay? Alright, and so I have removed a lot of the superior part of the peduncle, of the fibers, so you can look and see the middle running into the cerebellum. Eh? So this is going to be a middle peduncle, that's your superior peduncle. Right. And you can just see where it is going to. That helps you to know unmistakably that it is superior peduncle. And this is into pons, so it's middle peduncle. Right. Okay. Now, this is going to be basically what? This one here. Middle, right. And you see, the superior is posterior. You see it? All of this is definitely in line with the inferior colliculum, going up to the tectum. I've shelled off the a lot of the fibers so you can see the internal section of the fibers of the peduncle going directly up. Right. The middle one, right here, you can make out, is going for the pons, going towards the pons. The inferior is pretty small. Inferior here is very small on this specimen. Alright. Here is what? Pons, good. And you can make out the fibers that are connected. See it on the level? Pons, right. Now, underneath now. Underneath here. You see a double thing on, see if you can, you see something on top here? Like a line? Why do you think that is? That. What did it remind you of? Like a rope. You see it look like a rope. And it's coming from the medulla. It's hooked onto the medulla. The restiform body. The restiform body. That is what it means. Restiform, and the rest of it that is hooked onto the inferior is the juxta. Sorry, Montego. Is the juxta restiform. So the rope-like appearance, that's the restiform body. And the rest of it is called juxta restiform. Juxta means nearby. The inferior cerebellar peduncle is the name you would know. At least the name you should know. But the inferior peduncle is made up of two things. The restiform body, which is the rope-like part, and the juxta restiform body. Right. So the two make up inferior peduncle. Inferior cerebellar peduncle. Right. Okay. What is this vessel here, man? Basilar artery. Right. Okay. And this has quite a number of nerves lying here. Look at these. This little body here is what? Olive, good. So what are these nerves right here? Rootlets of the hypoglossal. Right, and you notice how they are rootlets. So they're going to, just like how your spinal nerves have rootlets taking a segment of the cord and coming to form a root. Similarly in here, the rootlets are coming together and they will form the hypoglossal nerve. And then they'll pass through what? The anterior condylar canal. Right, okay. Alright. Why is this fellow in the corner over here? What this might be? Okay, maybe no. That's not fair. But okay, come on, give a shot at him. Coming up right here. Look at him, good man. Look at him, good. He long from down here, look. Table 2. Table 2. Why is this fellow here, man? No, man, not at all. Not at all. Look at where he is. Running up on the side of near the upper cervical cord. Why do you think he is? Spinal accessory. Alright? That's why I asked you table 2. Alright, so that's spinal accessory there. Alright, let's look at another. When you look at the image of the side, it looks like rootless, little branches. The spinal accessory? Yes, spinal accessory is more inferior because remember that spinal accessory has a upper part of it, or rather the lower part of it is with the neck, the cervical nerves. Right, that's the reason why they sometimes call it spinal accessory. So the spinal nerve is an accessory to the rest of the cranial part. What I showed you on the side was, you notice it was, look, where is it? Put it down somewhere. Look, what I showed you here is this piece here, which you know is a long nerve. This, look at it. Good. So what happens is that it has a cervical component and it has a cranial component. Why you call it nerve? The 11th cranial nerve, why you call it? Spinal accessory. It has an accessory in the cervical, in the upper cervical part. Like the upper 4 segments of the spinal cord has a contribution to this nerve. So what happens is that it comes up here on the side and then it runs down with 9 and 10 in the jugular foramen. So that is what he's doing here. Well, 9 and 10 is not going to have any cervical component. 9 and 10 are purely medullary. But the only one that has a cervical accessory is the 11th. So that's how you know. Yeah. They won't be well, they won't be really belonging to the cervical spine. Yeah. If you remember embryologically, it is like occipital somites that have a contribution for the tongue, occiput. It's just because the neck is nearby. You probably might find a couple of fibers seem to be attached, but they are not really cervical. Alright. You're hungry? Alright. Okay, well, you want to leave it at that? For today? Okay? Alright.